of like a continuation, and we'll be making some repetitive comments, from session 2, but we're going to focus on building self-care. So today with me, I have Michelle. Many of you know because she's the one that has been helping us with the registration. Hola, Michelle.
Hola.
We also have Dr. Raquel Romero, an essential part of the Reach Center. She ran with us the focus group. She's been helping us with every single workshop. She's embedded in the community, so it's a pleasure to have her here. Hola, Raquel.
Hola, buenas tardes. Thank you so much. Welcome, everybody.
And then later on, she's running a little behind, but we'll be having Dr. Kanzler as well. You met her in the last workshop, also sharing with us to provide different perspectives, about our thoughts and our experiences with self-care. So this moment, I give the floor to Raquel, who will be introducing us to some basic rules.
Thank you so much. And again, welcome, everybody. It's an honor to be with you today. And thank you so much for your support and taking time from your day and share that with us. These group sessions, these group workshops, it's we want to have 2. This is the second of the 2. And that was because we did a focus group before. And your opinion is so important. So we, as Dr. Garcini was mentioned, we encourage you to please write down your comments, your questions through this presentation, and later you can reach out to us by email because it's going to be offer credits, units, the certifications. We asking you please write down your name and your email address in the chat box. That is going to help us for the list of who attended those sessions and also for keep the information later with you. And this is going to be recorded. So if you feel comfortable, you can just leave your name or you can change it in the box. And encourage you to continue answer those surveys. These opinion groups are very important. So thank you again. And it's your time, Dr. Garcini. Thank you.
Wonderful. Thank you very much. So I hope you enjoyed the topic of today. We consider it essential. We're going to skip the introductions because I feel like we're family by now, right? We kind of know each other. And it's more important that we share with you the content rather than who we are and what costumes do we use. So we're going to skip a little bit. Our work, as I mentioned before, is sponsored by the National Institutes of Health. That doesn't mean that our thoughts reflect those of the organization. The agenda for today, what we'll be talking about. So the first one will give you a little bit of background as to how can the COVID pandemic lead to stress and burnout among you, the people that are literally in the trenches at the forefront of our communities. Why is self-care important? And then we're moving to how do we take care of ourselves, how to identify signs of burnout, and what are some coping skills and resources that you can use to take care of yourself before you can take care of others. We talked about the training goals in a previous session. We covered our training goals 1 to 4 on session 1. And this session will be focusing basically just on goal 5, which I believe is the core or the most important to be able to do 1 to 4, right? Which is taking care of yourselves. If we don't take care of yourselves, we won't have anyone to take care of our communities, to bring the information that we need, to bring the interventions, to communicate with us, because it works both ways. What are those needs in the community? So I hope that as we walk today through this topic, we can convince you that you're the most important things for our communities to thrive, and that we need to take care of yourself, and we all need to take care of each other so that we can continue to push our communities forward during these unprecedented times. So we're going to start with a little as to the background. And I have something prepared here. I was going to tell you a story, but I realized that I talk forever. So the story was going to take probably half of the session, ¿verdad? And I didn't want to lose any of my participants. So I'm just going to go for the ending of the story. Let me know if you want to hear it, and we can record it on the video. But for those of you, I don't know how many of you know the cactus or the nopal. I'm a Mexican, so it's like my bread and butter. It's a big symbolism in our country. So for those not familiar with the nopal, The nopal is a plant, basically, that grows in the hardest of the hardest conditions with very little water in the middle of very dry conditions, and that can sustain everything, and it grows with very little. It gives a beautiful fruit that tastes delicious that is called the tuna, and it also gives some pretty flowers. So the reason why we're using the nopal here is in the Mexican culture, the nopal symbolizes grit, strength, and courage. Because of that, right? Because it has learned to survive with very little. It basically takes care of itself, and that's how it does it. Yet, that doesn't mean that it cannot produce fruit. And it bears a beautiful, delicious fruit. You actually can see it right there on the tops. So how is it that the nopal or the cactus takes care of itself under such harsh living conditions? Well, it has been equipped with whatever it needs to take care of itself. And part of it is thorns. So if you look at a nopal, you cannot touch it because it has thorns. You know, you will hurt yourself if you just literally grab one of them. But there's a purpose in those thorns that the nopal is equipped with. The first one is to predators, to protect them from predators. So like if you have an animal trying to grab it, you need to stay away. So it helps the nopal sets boundaries, healthy boundaries to keep surviving so that it can bear the fruit. And the other one, I didn't know this, and I thought this is the coolest fact, is the thorns help create little amount of shade that protect the nopal from drying, because all the little water that stays on the surface, so the surface, if you take the spines, which is basically when we eat it, it's a very smooth surface. So the water evaporates because it lives under really hot conditions. So the spines create a shadow that prevents that water from evaporating so that it can live. So why do I tell you this? You might go like, okay, so what's the relevance of the nopal, right? And I think it's because I see in every one of you that resilience of doing the best you can with very little that is given to you to help our communities. Sometimes little training, sometimes little resources, and a lot of demands, and you still bear that fruit that keep moving our communities forward. But at some point, we need to be like the nopal. We need to take care of ourselves. We need to discover what are those thorns that are going to keep us healthy so that we can protect ourselves to bear that fruit that our communities need. So in a nutshell, I'll be making a lot of reference to that nopal so that hopefully you can fall in love with it as much as I am, and as much as it represents for me a sign of grit and strength that our communities need and that you have, but also a reminder of the frailty that we have and the responsibility to take care of ourselves to do the best that we can. So how may the COVID pandemic lead to stress and burnout among community health workers or promotoras or community leaders that are at the forefront of dealing with the battles that our communities face? So the first one is that there is a high demand. There is too much work to be done and very few of you to do it. So a lot of the time that's very taxing and leads to a lot of stress. The other one is a lot of the cases that you deal with are not easy. You know, unfortunately, the lives of the families that we deal with are complex. They have many needs, they have many problems, and they do it with very little resources. So unfortunately, a lot of that, you know, remember we talked in session 1 about the backpack and the rocks, right? Well, I think every family that comes to you has a huge backpack with more rocks. And in that process of working with them, sometimes you say, okay, let me grab some of your rocks and put it in my bag. But imagine if you do that for every single family that you take care, it's gonna lead you to stress and burnout. There is no doubt about that. You all work long hours. You're embedded, you're part of the community. So it's almost like you can never turn the light off, right? And say, I'm not home, you know. Sometimes people will knock at your doors. I've seen it, I've heard it. People have your cell phones, you know, and sometimes you will even become the provider of your own family members when they know what you do, right? It's almost similar to what happens to us when people know that we're psychologists, everybody, the minute you sometimes say, do I want to say what I do? Because the minute you say, people, oh, let me tell you something. And there's never a possibility to talk about anything else. You're constantly thinking, right? And people are looking up to you for help. But it can be very hard and very tiring. Sometimes you just need that space to yourself. Another that is very hard is that there's often not enough recognition for the work that you do, right? It's almost sometimes as if people don't see it. I think people value it, but we don't express that. Unfortunately, we live during times that people don't tell each other, a lot. I really appreciate what you do. What you do in my life makes a difference. Thank you for what you do. What can I do for you? We just take a lot of things for granted. So a lot of the work that you do is not appreciated. And when that happens, you experience emotional tiredness, emotional fatigue. Because we thrive on praise. We thrive on positive words, on positive feedback from people. The other one is sometimes you don't have a lot of support and a lot of resources to do your work, and it can be very, very frustrating. There is a lot of situations in the everyday work that you do that are out of your control. You can try to provide people with resources or with guidance or with, with direction, but unfortunately, a lot of the times their lives are so complex and their situations are so rigid, right? For example, when people don't have access to healthcare, when they don't have money to pay for basic needs, or when they have lost their jobs, or, when they live in very, very difficult situations within the family that are beyond your control. No matter what you do, you will not be able to help people move forward. And unfortunately, a lot of us take it like it's a failure of ourselves. There's always something more than I can do. And unfortunately, there's times when you don't. So we're not very good at accepting that there's situations beyond our control, that we have limits as to what we can and cannot do. And we get consumed with that. And that's another source of tiredness and of fatigue and of exhaustion that leads us to burnout. The other one is that sometimes there's limited training. So a lot of the times you have to do things by your own insight. You have to learn things on your own. You have to figure things out for your own. So imagine when people come and look at you as an expert, and at the same time, you're the expert that needs to keep trying to teach themselves. It's exhausting, which leads me to the imposter syndrome, right? We have it all the time. I have lived with imposter syndrome since I arrived to this country, wherever I was, even when I started graduate school, I started late. I think when I was 39 and my English was not perfect. I did not know anything about statistics. And all of a sudden, there I was in a classroom full of very smart kids that were almost the age of my children, all understanding what those X and Y's were in the board. And I had to fake it. And I had to fake that I understood what I knew, but I didn't. So every time I went home and I think, oh my God, they're going to find out that I'm a fake, and they're going to kick me out and it's going to be embarrassed. How am I going to go back to my husband and says, I can't do it. We got to go home. We got to get back, and I consume myself rather than say, yes, I have limitations, but, I was good enough to make it in here and I have my own talents and my own gifts. So we put a lot of pressure on ourselves to do the best. But with that comes those costumes that sometimes are so uncomfortable and don't let us express who we really are with our insecurities, with our gifts, and with our strengths. And then on top of everything, you have your own personal needs, right? You're taking care of everybody else's family, but our families are also complex. You have to take care of your kids. You have to take care of your parents, many of you. You have to take care of husbands. Many of you are single mothers or single fathers. Many of you are struggling with divided households. Many of you have family in our countries of origin. Many of you are struggling with financial issues of your own, right? And then sometimes we get pressure from our family members. Well, how come you're helping everybody else? If we're barely making it here, barely struggling. And that puts a lot of pressure, and it's hard to explain, and a lot of people don't understand it. So hopefully, I have given you a context so that you can understand why it is important that you take care of yourself, because you're carrying a heavy load. And if you don't, it will crush you. So we need to prevent that, because our people will continue to need you. Our families will continue to need you. Do you have any comments in that regard, Michelle or Raquel? Or any comments that we have in the chat so far?
I made it back, Luz.
Oh, yes, Kanzler is back. Wonderful. Thank you.
My background is not working today, so I can't blend in with this beautiful background, so you'll just have to have my house.
Good to have you back. Great. I told them that you were kind of rushing through it, but that you're here. So welcome. So if you want to comment in what I just said, we'd love to have your perspective.
Oh, sure. I mean, I certainly caught the last part of what you were sharing, and all of these things we heard in our focus groups too, right? When we were asking everybody what's stressful about your work. And yeah, we could probably fill our whole time talking about the risks that community health workers have and for stress and burnout. Yeah, there's a lot.
Yeah. So, maybe, Kitty, I'll leave you this. You're so good at explaining what's the difference between stress and burnout and how those one become the other, that if you want to take the floor on this one, it'll be great.
Sure. Thanks, Luz. Yes. So, and we talked about this too, that, stress is something that it is very normal. It actually has it can have some benefit. It can help us keep going. And when we're under a lot of stress, though, it's chronic. And it's almost like this picture shows like your battery is getting lower and lower and lower. And that can lead to this sense of burnout. And with burnout, I actually really like that word. It's like you've been burnt, out, like there's nothing left. So it's a sense of emptiness, a sense of you can't give any more. So I know we'll talk a little bit more about what the symptoms look like, what the symptoms of stress look like, and the symptoms of burnout. But I think if you just keep in mind that visual too, it helps to show some of that difference. With stress, you're going and going and going. With burnout, you can't go anymore.
Yeah, absolutely. And I think it sometimes happens, right? Because we're not aware of it sometimes, and stress is something that we can handle. It can happen almost like overnight, that you turn around and I say, how did I get here? I was feeling stressed, but I was still having the energy to go. And then you wake up one day and you say, how do I get out of bed?
Mm-hmm. Does anybody ever have that where you're tired or you're stressed or something, and then the littlest thing happens and you just you bump your head and you can't stop crying, or the smallest thing and you're so angry and it doesn't make any sense. Like you said, these things can creep up on you over time such that you don't realize how it's affecting you.
Oh my God, I love this comment that is in the chat that says, toasted as a concept. That's the perfect word to simplify burnout, right? You are toasted, you no longer have that little town or that bread that you put, when you come out of the it's so delicious. No, you're toasted. There's nothing left, right? You don't even taste good anymore. So absolutely. But that is why it is the importance of preventing that stress, of taking care of yourself so that the stress doesn't have to turn into burnout. So why it is important to take care of yourself? Well, first and foremost, because you can give what you don't have, right? So what does self-care mean? What does it encompasses? Well, the first thing is that it's different for everybody. You're gonna have to find what works for you, because what works for you to develop and build self-care is gonna be very different. For example, what works for me to what works for Kay, to what works for Raquel, to what works for Michelle, or for every single one of you. So you just have to find what are your preferences and how you plan to take care of yourself. No one can tell you how to do it. It has to come from within. it is about engaging in activities and behaviors that have a positive effect on how you feel, on how you think, on how you engage in your everyday life, on the things that you do. And one of the most important and very difficult things to think about, particularly from those of us that come from collectivistic cultures, right? Like the Latino culture or the African American culture or the Asian culture, when, it's all about us as a group. It's almost hard to think of like us as the individual, right? So we tend to feel selfish. If we engage in self-care, means that I'm going to be spending time on myself when I could be spending taking care of someone else, and we feel guilty. And that guilt is horrible. Remember in session 1, we talk about the little voice of the little, the devil in our head that goes, yeah, you're not doing it right. You're selfish. You're a mean person. That's evil for doing that. You should be doing that more. If you have time for yourself, that means you have time for other people too. And I think that's when we run into a lot of trouble and we give in of not really taking care of ourselves, because the guilt is so uncomfortable that it doesn't even let us enjoy the activities that we're supposed to planning to take care of ourselves. So we need to change the tape recording. We need to change the voice that is in our head and reframe it, because taking care of yourselves is also, it's not about me first, it's about me too, right? It's like, I need to do this too. And you will find, we'll talk more about in other slides, but what are some of the benefits? What are you gonna find out? What are you gonna learn about yourself in taking care of yourself that you can teach others? Because, sometimes we give advice, but we really don't know if we haven't practiced it ourselves. So the goals of self-care are to reduce stress so that we don't get to what Katie was telling us, burnout, to build strength to cope with challenges. If we're constantly tired and fatigued, we're not going to do the best care that we can or the best work that we can. To preserve relationships. When we burn out, we just want to isolate. We don't have the energy to listen to other people or to even talk to other people. So imagine how you're gonna do your work when a lot of your work requires listening and talking, when you just don't have that anymore. Or we become irritable, right? And that's really hard. And a lot of the time, you leave your work out there, you come home and your family needs you and you just don't have any more left. So you just start being in a bad mood. We talk about this in session 1. You feel like you cannot even stand yourself. So that's what happens. So the goal is to help you maintain better relationships with those around you, to communicate better, not only with the people that you work with, but also with the people that you live with your family members, with those close to you. It helps you preserve your health. We know that when we're stressed, for those of us with chronic conditions, the symptoms of stress are going to flare whatever you have. If it's diabetes, it's going to make it worse. If it's hypertension, it's going to make it worse. For me, I have an autoimmune disorder that affects my eyes. That's the first thing that goes. Next day, I'm having corneal lesions. I can see, my eyes hurt, and I can do my work. So I think it is the other goal is for prevention, to maintain your health so that you can continue to do your work. And help those in need whenever possible. And the other one, as I mentioned before, to be a role model. Katie, do you want to take us through the benefits of self-care? I mean, we kind of talk about some, but.
Sure. Yeah, I agree. I think that you did touch on a lot of these already, in that, like you said, you can actually prevent burnout. It's really hard to come back from burnout. It's so much easier to prevent it. Mm-hmm. So it's not impossible, but prevention is always, the preferable than trying to treat yourself when you've already gotten to that toasted point. Mm-hmm. But the focus, I think, is important. We have these things that are important to us, and we talked about this last time too. What's most important to you? And if you really value those areas of your life and those people, you have to have enough in your tank to give to them.
Mhm.
So all of those things you talked about, Luz, like why self-care is important. Ultimately, it's so that you can live your life in a way that is meaningful to you and connect with what's most important to you. I do want to comment, maybe I saw somebody wrote this really great insight that sometimes other people might judge you, right? Like, oh, it must be nice to take a yoga class, or it must be nice that you get to breathe for 5 minutes, or take a walk, or watch your favorite show, right? So yeah, I was wondering, maybe we could talk about that. What do you do when other people don't think it's okay for you to take that time?
Mm-hmm. Mm-hmm. Raquel and Michelle, any thoughts on that? That's absolutely true, and more pressure.
I love what someone said about yoga and Tai Chi classes have helped them, that Teresa Cervantes mentioned. I personally like to go to Tai Chi Wellness and just to do the reflexology, and that helps me a lot. Sometimes when I can't do that, you know, for financial reasons, I just get the heating pad and I put it on. So a lot of times these little things really make a big difference. So taking the dog on a walk, just walking, you know, getting the mail, whatever it may be. So these little things are excellent benefits of self-care.
Mm-hmm.
One of the things is that it's not necessary to have a big thing that can create stress. It's just maybe the accumulation of many little things through the day. And then in the top of maybe our health conditions that make it a little bit more complex and complicated. And someone writing down like sometimes it's difficult to recognize, right? To recognize ourselves and where we are and why we are overreacting. So yeah, it is. I think this is important for us to just stop and think and start thinking, why am I reacting like this? And maybe just walking away, that helps me when I feel stressed out. I just go and walk a little bit and I feel a little bit better. So maybe something that we can start with. Mm-hmm.
I have to share this from CC Robertson. It says you have to ignore negativity and give yourself permission, you know, the negativity that feeds you, because that's a lot of it right now, especially during this pandemic. There could be a lot of negativity going on, but we ourselves have to, you know, take care of us so that you, promotores, can go, or promotoras can go and take care of the community.
Right, and I think that comment. Oh, go ahead, Luby.
I said, I just wanted to make a comment that sometimes we need to let the people around us know how we feel, because we expect them to, you know, to know that we're not feeling okay, or that we're feeling overwhelmed or tired. And I know I have people that say, oh, your work, you know, you're on the computer, you don't, you know, like right now that you say, they don't feel that's stressful, that's not work, you know, but sometimes, you know, your mind, you're just, you know, even physically, you know, just having to be on the computer and then hearing everybody else's problems and your own can become overwhelming. So you need to let people know,
Yeah,
and not assume that they should know how you feel.
That's such a good point, Ludi. Right. So if other people don't understand why you're taking time to take care of yourself, maybe they don't know how you're feeling. They don't know what's going on. And it depends on who it is that's judging you, I think. You know, if it's a spouse, well, that's going to be a little bit of a different situation than if it's maybe a neighbor or maybe somebody you don't know as well, right? Because you have to manage those important relationships and negotiate that time maybe that you might need. And like somebody said, it's like the emotional bank. If you're going to withdraw, if you're going to say, you know, to your partner, I'm going to leave and you're in charge of everything, the kids and the dogs and the cats and everything. Well, maybe you want to make sure that you've both talked about it and you're in a good place, you know, for something like that. So, and I like what someone else said about having compassion for yourself. But we will talk about that some more too, the idea of self-compassion. And ultimately, if other people are judging you or not, you're setting a great example for them and saying, this is important. I need to take this walk. You know, I need to close the bathroom door and hide for 5 minutes. It might be that simple, but that is such a good example for the people in your family and the people you're working with in the community that, look, I take care of myself. Therefore, you can trust me when I encourage you to take care of yourself.
yeah. I think also, you know, another important thing, I see the last point here, right? Sometimes when we stressed out, and we get sick, right? I mean, when you're stressed out and burned out, your immune system, we know that, your immune system gets reduced or malfunctions, and then you're more likely to get sick, right? Or you're likely to get depression, and then you become a burden to your people, right? Because other people need to take care of you. So that's another important thing, that, you need to have the responsibility to take care of yourself so that you don't become one more burden for your family, particularly under the conditions that we're living right now.
Mm-hmm.
So we're moving to section 2, which is, kind of the same thing that we did before. We understand now why it's important. I think hopefully the majority of us agree that it's something that is important to do, but we know it's not easy. So we're going to talk about, okay, so how do we actually do this? And I picked this image because it reminds me so much of you, right? It's almost like this person that carries the entire community on their shoulders, right? And then there is no doubt that you can do it. But when you look at his face, he looks tired, right? He looks like he needs some rest. And that's exactly what we want to do. So maybe it's not about carrying them in our back, but maybe it's about walking hand by hand, right? So that you can both smile. So how do we go about and do that? And we have the first step. And Katie, I don't remember who was going to do this one, but we'll just go and take turns.
We have about an hour, less than an hour, 55 minutes to be exact.
Oh, wonderful. We have plenty of time. So if you want, I can take this one, or do you want to take it?
You know what, Luz, I'll take this one.
Okay, go ahead.
So this is just such an important first step, whether this is for yourself or the people you work with, or what are the barriers? What gets in the way of you doing the self-care? Because like Luz said, okay, we're all here. We think it's important. Obviously, it's important. So why don't we do it? Why aren't we all totally relaxed all the time and feeling good and managing our stress perfectly, right? Because there are barriers. And some of these barriers we've heard from you all, and it would be great if you have other ones you want to throw in the chat, please do. But a lot of times it's just not being aware of your own needs. And we talked some last time about paying attention to your red flags, to the signs of stress in your body. So being aware of your own needs is important. Doesn't it feel sometimes like there's too much work to slow down? Like I can't slow down or then I'll get really behind. It could feel like that sometimes, or the sense of responsibility that if I take a break of any kind or pause, it's not the right thing to do. It's that guilt. We talked about this, putting other people first, especially if you're a caregiver at home and you're a caregiver in your work. It's like you're always putting other people first, which then the guilt and shame is listed there too. I think that not knowing where to start is an interesting one as well, because you get a lot of advice, which you're getting some more today, about the different things you can do to take care of yourself. And it can be hard to know, what do I do? Which thing is most important? What's going to make sense for me? And sometimes when you think about that, well, what would you do to relax? It can be like, I have no idea. Sometimes you really don't know. So this is all about taking that time to pause, pay attention, and think about that. But knowing your personal barriers is also going to be helpful, because then you can figure out some ways to work around them or even to work with those barriers. Is there anything else you wanted to add there, Luz?
No, absolutely. I mean, you gave us a great background, right? And that's why I also I love, I'm very visual. We come from a culture that sometimes an image tells us so much. And when I was looking at these mountains, right, they look really pretty and they have all those colors, but there are barriers to get to where we want to be. And if we really look at this, some of us who come, like I was mentioning, from cultures where it's not right, you don't think of yourself first. It's about us. It's not about you. Then it's almost like these mountains become part of our everyday reality and we don't see it. So we need to work extra hard and change the way we think to say, yes, it's about you. And I take care of myself so that I can take better care of you, so that I can give you the best that I have, rather than doing kind of my work halfway or creating more problems. but it's absolutely something that is very, very hard to work at, and something that you need to take your time, sit down and see what are some of those things that get in the way in my day to take care of myself. So moving on to step 2, we talk about this in session 1 in a little bit different context. So I want to kind of switch it a little bit for you. So in session 1, we talk about helping people to identify their priorities. When they come and work with you, what are some of those things that they need to tackle first? You won't be able to tackle the 10,000 things or 10,000 problems that are happening in their lives. Pick one, the one that is creating them the most trouble, and define it in a way that you can achieve some change. So I want to change that to you. Think about you. Think about taking care of yourself. What are going to be some priorities? What are some of those things that you need to do first to take care of yourself? Is it going to be carving time during the day? You know, is it gonna be, are you gonna take care of your physical health? Is that the first priority that you need to take care of? Is it your emotional health? Is it your intellectual aspect? Where are you having the most trouble? You need to think about that. If you're struggling with a chronic illness, that probably needs to take priority, right? If you already know that you're struggling with a lot of anxiety or depression, or if you have a history of trauma and you need to be helping people deal with their own trauma, maybe your priority in terms of self-care is going to be your emotional health, right? If you feel like you're having trouble paying attention anymore, that you feel like your mind doesn't rest, that you go to bed and you keep thinking, and I'm guilty of that. Michelle is a witness. When I sent her the text in the middle of the night and I said, oh, look what I wrote. I was thinking in my sleep. How do you slow down your mind? So remember, in session 1, we talk about identifying your symptoms of stress. That's going to give you the information to set up your priorities. It's going to tell you what do you need to do first in terms of taking care of yourself. But no one can decide those for you. You need to do it. You need to write your own list. And sometimes we forget because we're so busy and we're like, oh, I'll do it tomorrow. And tomorrow never comes. So make it a routine. Have a list. Maybe change it every month, right? Where you write 3 priorities and put them in the front of the mirror every morning when you wake up, so that you can see it and remind yourself that those are the things that you need to do to take care of yourself. Any feedback that we might have or anything else that you ladies want to add?
I love what Maribel said, that she uses aromatherapy, breathing techniques, and she has a small water fountain in her room. I love that while she works.
She has a spa.
I love it. I have my aromatherapy here too, my from Bath and Body Works. So yes, all these techniques are amazing, and I like that you keep bringing these up to the chat room. Thank you so much.
There is a comment. It says, I have a headache when I have a stress. So that reminds us how important it is to start learning to listen to our body, right? To listen those signs that we have and acknowledge there is a reason why we have a headache. There is a reason why we have so back pain or other symptoms, right? It's very, very important to start acknowledging that there is a reason why, and start listening to our body, taking the time to do that. Mm-hmm.
So Katie, I give you the floor to talk. This is a fun one, the difference between stress and burnout.
Yes, and this just builds on what we had mentioned earlier too. And maybe right now, as you're looking at the list of the different types of symptoms, you can even do a little self-inventory and kind of understand, am I more on that stress side where I'm kind of overwhelmed, I'm over engaged, very, very busy. I kind of have this sense of like a motor inside, and it's you know, like I said, you can have very positive stress. Stress can really work well for us. It keeps us moving and motivated and excited, but then it can push us into where it's an unhealthy stress and a chronic stress on the body and mind. So do you feel exhausted? Do you feel anxious? Do you feel like your energy is really low? you're going to be more so experiencing signs of stress. Burnout is a little bit different. A lot of times we think about burnout in terms of our work, and we talk about it in terms of people who provide care to those who have been hurt in some way or traumatized in some way, like first responders, healthcare providers, community health workers. You're providing all this frontline care for people, and especially during this pandemic, you're giving and giving and giving and giving, not just to community, but probably to your family too. With the burnout, there are three main symptoms of that burnout. One is an emotional exhaustion. So not just feeling tired, but like you're just emotionally done, emotionally drained. You could even feel numb. Another symptom of burnout is feeling like you're not fulfilled in your work and the things you're doing anymore, like it's not meaningful to you anymore, even though it might technically be, it just doesn't feel it. Like you don't feel connected or excited or interested in what you're doing anymore. And the other is feeling that sense of like a detachment, right? So it's almost like you're not there. You're going through the motions. And so burnout is a little bit more of a severe type of version, of stress. And those who do work like you all do, and by work, I don't just mean paid work. I mean, any kind of giving, any kind of being with people, hearing difficult stories, dealing with trauma, you are at very high risk for burnout because of the nature of your work and the nature of what you're doing in your communities and in your families. So take some time and think about, am I dealing with stress? Am I dealing with burnout? Have I dealt with those in the past? And keep alert for those signs and symptoms in yourself. I see a comment there, just going through the motions and not putting forth a lot of effort. Yeah. Yep. It's just like, well, I'm doing it because I have to. Your heart is not in it anymore. It's like your heart just, you can't give anymore.
Yeah, it's interesting when you mentioned that. It takes me back some of the times when I go on field studies. So a lot of the work I do is with undocumented community, and I do it in migrant shelters or in deportation places and stuff like that. So we have days where it's just from the early morning to late at night, just listening to constant trauma stories. But when I'm in the field, I have this energy, right? I get very tired. We don't eat. We have a lot of tension, but we just go. Would you just go and you start, because the stories that we hear are so hard that you start saying, if they can do with that, I can do this. And we go through hours, through 5 days. But the problem is when I come back, right? And the minute I step home, I have had days where I just drop my luggage, I sit down and I can't stop crying. And it's just, and I have had my family members that says, this is worrisome, what's happening to you? And the hardest part is that it takes me a long time to bounce back, to be me. And I think, how do we do that when we love the work that we do so much, but we don't have those limits of those barriers to not let that stress of those intense moments lead to burnout, right? We just keep going. So absolutely, I think this is something that has happened for most of us. Katie, how have you felt burnout?
Oh, how have I felt it? Gosh, well, when I was in the military, I definitely had times where I was burnt out. And there is that sense of not being able to even, it's like work and home are all blended together. I started to work with some people, a lot of people who had very intensive trauma at one point in time. And I started to dream about their trauma. So I was having nightmares. Yeah. On almost like because of what I was hearing, and my brain was trying to process it and couldn't process it. And there was so much. And so I was able to kind of be aware of what was happening, but it was very hard in the moment because I felt like I couldn't stop the care, which I didn't need to. I just needed to do more to kind of like bring my battery up.
Yeah.
But that was a sign for me when I started to have my own dreams and nightmares about the traumas, and I started to imagining like that those were happening to me. And that's also something related to burnout, which is the secondary trauma. If you're with a lot of trauma and a lot of pain, sometimes you start to have reactions similar to that because you've been exposed to it. And so it's definitely something that I've had to deal with before, that burnout and the secondary trauma. It's a real thing, and it's hard.
It's very real, and it's almost like survival's guilt. I mean, I remember sitting down to dinner days after and just not even want to touch my food. And I'm like, I don't even know if they're eating, or not enjoying anymore your own life, right? So it's definitely important to identify those symptoms. And, there is no doubt that there might be periods where you have burnout. But thinking back now that I'm talking to you and, brainstorming this, is like, what did we learn from that experience so that next time that we're doing our work, we don't have to get there, right? So for example, in my case, it might be, well, instead of 50 interviews a day, I'm just gonna have to do 30. And I'm gonna have to stop. And yes, we won't be able to help everybody, but we'll be able to protect ourselves to continue to do the work we do, right?
Right, it's about knowing your limits, because you can help 0 people if you burn out, right?
Yeah.
So we have to take care of ourselves, even if we're not able to reach the 100 people we want to. It's better than 0 if we're not even able to show up.
Yeah, absolutely. And this leads us to another excellent point, right? Challenging unhelpful thoughts, right? So when we start, we already talked about, right? When we feel guilty about taking care of ourselves because we feel selfish, or we feel like, well, if we can indulge in time for ourselves rather than be doing it for someone else, we are, we're not a good person. Or, for those of us with certain religious belief, and I include myself, it means that I'm not here for the purpose that I was intended to be, to is do the best for other people, right? They come first, not me. Without realizing that maybe what I'm going to be giving them is not the best of me. It's not the best that I can be because I'm exhausted and I'm tired. So we need to change those thoughts that come, that negative voice in our head, and challenge it and see, is that true? The easiest way that, it has worked for me in challenging some of my negative thoughts is thinking, if I were in someone else's shoes, right? If my daughter, if my best friend, if a family member were going through what I'm going through right now, what will they advise them? Will they have compassion toward them? Will I advise them to take care of themselves? Will I advise them to slow down, that it's okay? You don't have to save everybody on the planet. Would I? Most of the time, my answer is yes. But I don't do it with myself. So why not? And I think starting to think about this, what would I say to someone else if they were going through what I'm going through right now? And I love this quote, right? Taking care of yourself doesn't mean me first. It means me too. And remember, we talk about the image, right? Instead, at the very beginning of the man carrying the little boy in his back, maybe you need to walk hand in hand. And that means you too. That means taking care of yourself. Any feedback that we have in the chat about challenging unhelpful thoughts and what has worked for them?
I love this one. It says, watching a comedy show and enjoy laughter is my best remedy.
Yeah, sometimes distraction is helpful,
yes.
But that doesn't necessarily help us change our thoughts, right?
Yes.
It doesn't mean that it's not helpful. It's super helpful.
Yes. Changing the thought process, I think when I see this too, is that self-care is not selfish. A lot of times we think that it's being selfish, and it's not. Again, going back to what Dr. Garcini and Dr. Kanzler said, that in order for us to take care of others, we have to take care of ourselves. So don't ever think that it's selfish, because it's not.
And some of the things that they put in the chat doing to manage this is like, I like to walk while I'm listening music. That also is help, or I ask family to help with my duties, right? This is another possibility, working at home. Or when I stress, I try to do crafts. And this is right, because your mind is just moving away from that, and I like to do crafts. So I think that works also very well.
Yeah, there is another one that was very helpful for me. I come from a belief in God and a higher power, right? And when we look at the basics of creation, right? God rested. God took a day off, right? So if he did it, for us, how come we don't do it for ourselves? And it's all over different scriptures, and across different cultures that people rest. So I think and sometimes if we think back, for example, I come from Mexico, from a culture where people break in the middle of the day and they go and take a siesta, or they take it slower down. Maybe we need to start learning and looking as to how can we do more of that? Does that mean that they're lazy? I don't think so. It means that they need to take care of themselves. Go ahead, Ludi.
If I can share something, yesterday we had it was 4 of us, a group meeting, getting together for church sharing, faith sharing, and we were just talking, and it was 4 of us, and it was something funny that came out, and we were all laughing, and we were like really laughing, and I was like, and then I realized that I hadn't laughed like that in a long time. And we talked about that it had been so long that we said we actually needed this, needed to laugh like that, and it hadn't happened for the 4 of us in a while, and it's just hard to realize, how we get into that, especially around this time with this virus going on and everything that we have to deal with.
Yeah, that's a great insight. Laughing is so helpful for the spirit. So moving on, Katie, I'm gonna move it, and you have 2 slides on this one.
Yes, thank you. I'm really
the hardest one, but most important ones.
Yeah, I'm really happy to talk about this, because a lot of what we're focused on is how to kind of deal with ourselves and our own, the barriers that our minds throw up. And this slide is dealing with how to say no in terms of how to manage our environment and how to manage our work and all of our responsibilities. So this is a hard one. Assertiveness. Know that assertiveness is not aggression. Setting up your boundaries to take care of yourself, and not just yourself, but to be able to take care of all the things that might need to happen in your life. If one boils into all the other ones, then you don't get to do that. So it's really important to have some of these boundaries. Being assertive and saying no, or negotiating, that's not aggressive. It depends how you do it, and we'll talk about that. Saying no without guilt, that takes so much practice. And something I learned a few years ago, which has got me through a lot of being able to say no, is that every time you say yes to something, if you're the kind of person that says yes to a lot, because I do, we all do. If you say yes to a lot of things and you feel bad when you say no, just keep in mind that you actually are saying no every time you say yes. Because if you say yes to another commitment or another project or another meeting, that does mean you're saying no to something. You might be saying no to family dinner. You might be saying no to sleep. You might be saying no to spending time with children or other friends. You are saying no. So you're already saying no. The question is just, what are you going to say no to? Can you say no to the things that are not your priorities and that are not the best decision for you right now? So that helped me a lot with my guilt, to know that, oh, if I say yes, I am still saying no. It's just, what am I going to say no to? But let me talk a little bit more about this concept of assertiveness. So a lot of times we think of assertive as aggressive, and we go the other direction and we're more passive. You can flip it, Luz. And this is an acronym that I encourage you all to memorize. I had memorized it. You can go to the next one.
I know, I lost my slide.
Oh.
Let me get back to it. You can see it now. Okay, perfect.
Okay. This is the HARD acronym, HARD. So honest, appropriate, respectful, and direct. If you can capture all of those aspects of a conversation, you're being assertive. What happens a lot of times is, like this shows in the aggressive people, they're honest. I mean, they're not lying. They're honest and they're very direct. Okay. But they are not appropriate in their communication and they are not respectful. Now, if you're passive in your communication, you're not being very honest because you're not really saying the truth for you, but you are being appropriate, you know, and you are being respectful, but you're not being direct. And so whether you're being aggressive or passive, you're really not getting your needs met. And either side of those produces more stress. Assertiveness, though, being assertive, if you want to know if you're assertive, kind of check on the last time you had to do something difficult or say something hard or set up a boundary. Were you honest? Were you appropriate? Were you respectful and direct? And this is such a good little checklist to keep in mind also when you're thinking about setting a boundary, or you're thinking about, oh, I need to say no and I don't know how to, or I have a need. How do I get it met? I need to ask for something. And you can apply this HARD anytime in any conversation where it feels difficult, but you can do that, being honest, appropriate, respectful, and direct. So when I first learned this acronym, it was over 10 years ago, and it was really helpful. And I hope that it's helpful for all of you. So, and I'm wondering what your thoughts are on that, Luz, or anyone else on our team.
Yeah. So this one is really, really hard for me. You know, culturally, you know, it's not good to say no. It's very inappropriate. And I saw a comment that I love because I was like, oh, absolutely. I do not have any problem saying no, but then other people think I am rude or I am mean. And I think I have learned how to say no in a way that it doesn't necessarily sound like a no. So for example, if it's an opportunity, right? Or someone comes with more work, or, you know, in another case, or a person asks you to help them with another problem or with another issue, you know, first of all is validating what the other person is asking you, right? Or even saying, oh, that's like a very interesting opportunity. You know, if it's an opportunity, that sounds very interesting and I would love to do it. Unfortunately, at the moment right now, I can't do it. Hopefully in the future, but not at the moment. So you're not necessarily giving a straight no. It's almost like you're walking around it. But I have found that that's more of a culturally appropriate way of not sounding so rude and saying no. So the other thing that helps me a lot is framing it into I messages. So I say, right now I am having so many things that, you know, I would love to help you with that, but it's just, I don't think I will do my best work right now. And then people are like, okay, you know, that's okay. Other times, you know, when there's things that I'm dying to say yes, but my plate is already full. Like I just delay it. And the way I do it is I just say, you know, let me think about it. Give me some more time to think about it. And that actually sometimes cools me off so that I can step back and say, okay, what are the pros? Like Kitty was saying, right? What are some of those things that for saying yes to this, I'm going to be saying no to those other things that I need to be doing or that I should be doing, like taking care of my family, spending time in family. So just by taking that step and says, can I get you an answer maybe in a few days? Or can I give you an answer later? Let me think about it, or I need to consult with my family, or I need to consult with someone else. Find your way to delay it so that you can think what are the pros and the cons of saying yes and saying no, and how is that going to work best for you. So I have felt that it is all in the way of how we say things that can make a difference. But find out which are those and make it almost like your elevator speech, so that when you know someone is going to come with a request, you have a way of saying no. Anyone else? Any other comments that you have seen or that you want to make?
I agree. It is all in the approach. It's not what you say, it's how you say it. So a lot of times it's just approaching it in a different way, a different manner, and, you know, not feel guilty. So that's a lot that's embedded in our culture. Laura said, finally, I learned to say no. After that, she felt good. So it's baby steps. And that's a good comment.
And one of the things that I love about that comment is the aspect of the reinforcement, right? Mm-hmm. You know, when you say no, usually don't forget about it, celebrate it, you know, go and like pride yourself. If you have to look at the mirror and says, yes, you're strong, you did it, right? So that little voice that tells you, oh no, you shouldn't be doing this, like, oh my God, you're strong, you did it. And we have to remember that in doing that, sometimes we role model for other people how it is to take care of themselves, to learn to say no.
Mm-hmm. We have 25 minutes, Dr. Garcia.
Yeah, I love the comment just very quickly, but it says, it is hard to say no. Many comments like that, it is very hard. But then one comment says the tone of voice helps. So maybe just using the tone that we have and slowly and smoothly say, maybe I need to think about this. I can go back with you later. Let me think about if I can put that one in my day, and maybe that helps us, right? To be brave to say that in that way.
Yeah. And never underestimate the power of a smile. It's very hard for someone to get mad at you if you give them a smile. You can say a no with the biggest smile and kindness, and it's very hard for someone to take it wrong. So great, let's move to the next one. So, and this one is going to be fun because actually you gave us this knowledge, building coping skills. So several of you participated on some focus groups that all of us, you know, Raquel and Katie and myself did back about 2 months ago, and about what are our communities struggle with, and what I see that they're using to overcome the stress that they're dealing with in their everyday lives. Many of you provided us with excellent knowledge. So we categorize the responses, and I'm going to read you some of those things that you told us work for you. And you can start thinking as to, do I do this? How can I do more of that? You know, of course, we gave them a little bit of fancy names, you know, like psychologists tend to do, adorn the thing, but the knowledge came from you. You are already doing these things. So how can you do more of that? So first, we have behavioral strategies. And let me flip my page here. And this is about engaging in pleasurable and distracting activities that help you reduce the stress. So basically, do what you love. You told us that you are engaging since the pandemic began in gardening, in cooking. Some of you engage in painting, in sewing, in reading, and pet therapy, basically spending more time with your pets. These help you feel empowered, renewed. It helps you get distracted from stressful thoughts, and it increases your motivation to keep going. Another behavioral strategy that you mentioned that you engage in is relaxation, such as engaging in breathing exercises or yoga. And the way in which it helped you is because it gave you greater sense of control. It helped you feel calm, it freed you from overthinking, and it helped you make that connection between your body when it feels very tense and your mind when it doesn't slow down. You also told us that you engage in mindfulness. And mindfulness is the ability to engage fully aware in the present moment. Basically, just focusing on what's happening around yourself. And you do this by taking long walks, appreciating nature, or sitting down and listening to the birds just one afternoon. And that this gave you a sense of release. It helped you to slow down. It helped you to build resilience and increase your sense of strength. Then we have something that fancy psychologists like to call stimulus control. But basically what it means is just regaining a sense of control in your environment. And the way you did this was by establishing routines, by keeping your schedules. Many of you were telling us, well, when the pandemic came, you know, it was very hard for me to know what to do at what time, everything blended. And you said that by developing a routine and a of control, in a sense that even though there was a pandemic outside your home, that you could establish a normal life, which was beautiful. And the last behavioral strategies that you told us about was to try to find information from reliable sources, and that these help you feel empowered. So then we move to the second point, which is the cognitive strategies. And by what I mean by this is ways in which you use your mind. Remember that point about changing your own helpful thoughts? Well, what are some of those things that you said that you are doing to take care of yourself during this pandemic? The first one was normalizing, making sense of this stress due to what you were experiencing or to the tremendous amount of workload that you're facing as something normal and understandable. This helps you accept the difficulties that comes with the work that you do. The other one, we talk about this in session 1, validation. Learning to validate, affirm, and recognize your emotions. Helping to share your experiences or give testament to someone else, telling them how you feel, help you realize what were those emotions that you're dealing with. These help you feel connected to other people, and it help you feel supported as well. Next, we have taking perspective or reframing, shifting your mindset or your attitude so that you could see things in a better light. Basically, what we call the silver lining. And you did this by comparing yourself to those who are in worse situations. You know, we tend to look up, right? And see, well, I'm not doing as good as that other person, or I don't have as much as that other person. You told us that by looking at those who are struggling the most, it helps you feel comforted, it helps you feel thankful, it helps you feel reassured, and it helps you to count your blessings every single day. Next, we have collectivistic thinking. And for those that come from collectivistic cultures, it's about the we over the I, right? So you told us that it was by telling to yourself statements such like, if I'm fine, you're fine, then we're fine. Which if you actually look at it, it roots in self-care, right? I need to be fine so that we need to be fine, so that we can all be fine. It helps you build resilience and increase your sense of stress. I have 2 more. The next one was self-compassion and making statements of self-care to yourself, which allows you to release tension, help you become more patient towards yourself and others, and help you feel rested. And the last one is gratefulness. So making grateful statements about your life and counting the blessings that you have. So all that information came from you. And then, of course, you know, we have spirituality and religiosity. They believe that there are some things that are beyond our control, but that someone greater, regardless of denomination, that is taking care of ourselves, and that you can put it in his or her hands to take care of you. And maintaining your social networks. They have changed through this pandemic, but whether it's your family, whether it's your community, whether it's your coworkers, finding the networks that help you. So as you can see, many of you are already doing this. So how can you do more of all of these things that we told you to take care of yourselves? Any thoughts or comments or questions?
He says, sometimes I like to hear others, right? Sometimes just listen by others also helps to, like it was mentioned, validate our feelings as well. And it's so easy to be kind with others and listen carefully to others, but it's so hard to do it for ourselves. It is hard to be gentle and kind on ourselves, right? Because we always want to do our best to others, and it's not easy for us as well. So I think it's very good to hear all those comments to help us to be more in this, validate our emotions, right?
Yeah, absolutely. So step number 7, Katie, you want to talk to us about building a plan.
Sure. Yes, so you stuck with us all the way to number 7. But once you're here and you know things that are helpful, you know your barriers, you know what's important to you, well, now you have to put it all together and figure out how to do it. So routine is so important. We can't take that enough. I saw some people write about baby steps and the concept of practice, and absolutely, you might have to play with your routine over and over again to adjust it, to figure out what works for you. But if you don't build self-care, whatever that is for you, if you don't build that into your routine, it will not happen. Right? It's so important. So when is the best time of day for you? What is it that you want to do? What is it that you need to do more of? And what are some things you need to do less of? But that routine, having it every day, that you know that you're spending that time taking care of your health and well-being. The other point here, have allies. Have those people who will support you and who will be those friends that say, you're working too hard. Have you eaten today? Hey, maybe you need to take a cup of water. You know, the people that will support you, and the friends that you can even tell them, listen, I'm going to try this new routine. Can you hold me accountable? Having that, even just one other person, can be so helpful in sticking to a plan. Problem solving. We could spend a whole webinar talking about problem solving, but one that we really like and that you all probably use already is just doing pros and cons. When you have a difficult decision, when you're faced with, I don't even know if I should say yes or no to this, you know, I'm not sure what to do. Should I take this new job? Should I, you know, move from my apartment? Whatever the decisions are that you're faced with, can help a lot to use pros and cons, but make sure you flip them. So for example, I just mentioned something about, like, if you don't know if you should move out of your apartment, what are the pros of moving and the cons of moving? What are the pros of not moving and what are the cons of not moving? See, sometimes we only do pros and cons like for the one decision, but what if you made the other decision? What are the pros and cons of that too? It helps to get your mind out of kind of its normal way of thinking, and it breaks it up and makes you have to look at something differently. So a lot of times you might have to problem solve your schedule, your routine, your lifestyle, if you want to add more self-care into it. And then if you come up with a great plan and you're like, I'm gonna practice deep breathing for 10 minutes a day at 10 p.m. before I go to sleep. If that's your plan, just as an example, what's your backup plan? What if that does not work for you? You know, that goes back to the idea of, you might have to come up with another option, have a backup plan, and maybe your plan wasn't a good one in the first place and you just need to scrap it and do a whole other plan. The important thing is to not give up and say, well, I can't add walking to my life right now, forget it. You know, well, maybe you need to do it in a different way, or less frequently, or less intensive. Mm-hmm. It's all about being flexible and adjusting and adapting. And yeah, we might have our standard in our mind of like exactly what we want to do, and we might need to let that go, and that's okay. But what's something, just something? I like these quotes on here too. Always plan ahead. It wasn't raining when Noah built the ark. So it's that thinking ahead. What am I going to do if this plan doesn't work out? So that's it for me on this, Luz. I don't know if there are other thoughts.
Yeah, I love that one, right? When you say always have a plan B, right? You know, if I cannot do the activity that I was thinking today or the things that I was planning on doing today for taking care of myself. We had a quote on the Spanish session yesterday that said, remember that the letter A for plan A is only one letter there's 26 letters in the alphabet, right? So how can you plan and problem solve for that? So for me, it was interesting when my schedules changed when I got to start working at UTESC, and all of a sudden I start having meetings at 8 a.m., but that's my bicycle time. So what am I going to do? You know, I come first. So what I figured it out, I'm going to ride my bicycle during the meetings. So, what I do is I put a stand next to my bike, I take off my camera and I write in the meetings. The problems come, right, when I need to speak or on mute, But now people know that I ride my bicycle and the meeting, instead of 30 minutes, feels like 15, it's wonderful. So how can you think of incorporating little things into your everyday life throughout the day so that you can have those things that you enjoy? Little breaks, maybe during the day, go out, 5-minute walk, right? Michelle the other day say, when I'm so stressed in the middle of the day, I run to Hobby Lobby to just look at the stands. I love that. And I said, absolutely fine. It's like, Michelle, can I go? I said, you don't need to ask me. You're taking care of yourself. I know you'll do your work. So try to brainstorm how to integrate these things into what you do every day. Any comments that we have?
I love the Starbucks break. Yes, Starbucks is my hero. So it's always fun, except during not rush hour. Walk my dog on Zoom while they're doing a phone Zoom. That's great.
I think that idea of doing two things together, if you can, you don't have to even make extra time. Sometimes you're able to do something that's healthy for you and still take care of a task.
Yes. And it's actually fun, because you start, I'm pretty creative, and and it's such a proud thing. And I cannot say it, enough, like we made the point before, reinforce yourself. Every time that you say no, every time that you can challenge a negative thought, every time that you make a plan or a schedule or whatever, or that you do something that you enjoy, say good things to you, build yourself up, reinforce you, praise yourself, say how organized you are, how strong you are, how dedicated you are, how loving, how much you love yourself. We were created to be beautiful creatures. How are we going to take care of who we are, right? I think we have to honor that we have life and we have talents and we have power, but we have to take care of themselves.
Dr. Garcia, we have 10 minutes left. We've had so much fun.
Perfect. We're on 8 and we have 10 steps. So I think we got this, right? So this one is becoming a role model. We cannot emphasize this much. We talked about this in session 1, so I don't need to, to hammer on this one, but walk the talk for many, many reasons. First one, and most important, because in that you'll be setting an example for the people that you love, whether it's your community, whether it's your family. If they see you doing, if they see that you're investing in yourself, you'll be teaching them or you'll be guiding them in how to take care of them. And the other one, because there's so much that you could learn when you start doing these things. You will learn what works, you will learn what doesn't work, and you will empathize more with people as they're trying to implement their self-care. You will learn, to be more compassionate towards them. You will help them brainstorm how to solve it. But if you don't know how to do it, if you haven't done it, it's going to be very hard. So it increases your credibility. So always, always walk the talk. Next one, Katie.
Yes. So just real quickly, because of time, the concept of a safe space for yourself. Sometimes you can't actually get away into a space that feels safe physically. So it's important to create those really like a psychological safe space for yourself when you just need that, even a momentary break. It could be that you have a physical safe space, but having that emotional safe space, maybe it's a memory that you can go back to. Maybe it's, a picture in your mind. Maybe it's a place that was comfortable to you, and you close your eyes and you take a deep breath, and that is all you need sometimes to kind of ground yourself. And that's another word that's important, is grounding. What can ground you? Because there's so much going on sometimes. It feels very overwhelming. Maybe you didn't follow through with that self-care plan and you're just, what can ground you? And for some people, it's a physical thing. Luz had mentioned somebody that she worked with who had a rock. And I know people who do that too, where they have a little stone they hold. or a stress ball, or they have a bracelet or a necklace, something that they're using that kind of grounds them, that reminds them, hey, you're right here, right now. Take that deep breath. So there's more on the slide, which you can review later, unless there's anything you wanted to touch on, Luz. That's it for me there.
Yeah, I think, we are gifted. We are gifted with our minds, and we can make them work on our behalf or against us, right? But we need to use the power of our imagination. By closing our eyes, we can travel wherever we want. We can recreate the sensations we want. We're gifted with 5 senses. Use them in your imagination to create those safe spaces. Whether, if you're in a difficult situation, no one knows, just sit down, close your eyes, and remember, what does that place that makes you feel safe smells like? What does it look like with the eyes of your mind? What sounds do you hear? And all of a sudden you'll see the distraction that will take you. And the more you practice it, the more you'll train your body to be safe, in that safe space that goes with you wherever you want. So for me, one is going to the doctor. I get so stressed. I don't like needles. I cry, I make a scene, but I can always know that if I close my eyes and recreate my room in my head, I feel safe. It doesn't make it go away, but it makes it more tolerable or better. So find out, play with your mind, use that gift that you were given to find that space that goes with you whatever you can to make you feel better. And then we have developing survival skills. So basically what this is about is how to make the interactions with the community easier so that you don't get tired, so that you don't get frustrated sometimes with the work that we do, because as I was mentioning, a lot of the cases that you see are very complex. So the first one is always be prepared for the unexpected. Know that there is something that is not going to work out. Michelle and I had these when we were planning the workshops. And Michelle goes, I'm so stressed that something is going to go wrong. And I said, Michelle, why don't we start with knowing something is going to go wrong? The thing is, we're going to fix it. And sure enough, we mess up, I believe, survey 2 or survey 3. I don't even remember what it was. And Michelle called me and I said, it's okay, we'll fix it. And if we don't fix it, we learned something, right? So always know that something is going to happen. And if you start with that frame of reference, you're setting yourself for success, because anything better is going to be a win, right? The other one is try to listen carefully from the very beginning so that you don't derail. Human communication is very hard. Is very difficult because we have our perspectives and we have our biases. Sometimes a person can be saying something and we already interpret it in a different way, and then there's misunderstanding, and then you might end up going in one direction where the person was going in a different one. So try to use, remember in session 1, we talk about the mirror technique, which the mirror technique is paraphrasing. When you hear someone saying something, say, give me 1 minute. Okay, so what I hear you saying is, and then repeat what you understood what the person is saying. And what that's going to do is, first of all, is going to help the other person feel validated. And second of all, it's going to help you know what direction you're taking and if you're getting the information right, so that you don't get frustrated or you don't waste your time going in the wrong direction. The other one is speak slowly and clearly. Sometimes we try to think that that's offensive, but it's actually peaceful, I have been, and I'm guilty of that when I'm nervous or anxious, on presentations where the presenters go 1,000 miles per hour. I finish and I'm like, I didn't get anything. I don't remember. People remember if we speak slowly and clearly. So save yourself some headaches by doing that, by practicing that. Don't complicate a conversation. This is another one, and I think it goes with the next one, avoid the railing. Unfortunately, if you come from a culture like mine, we tend to derail a lot because we don't want to talk about difficult things or about emotions. So we want to tell stories. So we're going to tell you the story of the uncle, of the cousin, but we never talk about ourselves. And the point of the session with them sometimes is to talk about themselves. So how do you do that, right? And I think this is where you go back to those priorities in session 1, when you say, when you tell the person to establish the priorities and they come to you, you can use that card all the time. Okay, I would love to hear the stories that you're telling me right now, but we need to get back to the priority number 1 that you mentioned, which is, and then you put it in front of them. And that's the way you keep channeling the conversation, so that at the end of your session with them, you feel like you accomplished something, or that you kind of were able to know the real, because sometimes you finish it like, I feel like we didn't get anywhere. We just talk about, but you know, different cases, but we didn't feel anywhere. And that leads to frustration and burnout. Allow yourself to be repetitive. We have been so repetitive in this session too, if you haven't noticed it, right? Because sometimes we forget. And the more that you repeat things to other people and to yourself, the more clear, the more they will settle in, and the more that you will remember them. We talk about priorities, so I'm not going to go there for the sake of time. Set up a time limit. This is important. A lot of the time, you know, people don't realize they want to talk to you forever, and you only have an X amount of minutes, right? And the minute the time starts running out, you're not listening anymore. You just want it to be over because, you know, you have another patient or another client, or you have another place that you need to be at, or another task to engage in. So from the very beginning, let people know, today I'm really busy. I only have this amount of time. I want to focus on yourself. Let's focus on the priority and let's move on. If we don't finish in this amount of time, we retouch base next time we meet. But set the expectations so that at the end, you don't end up being stressed within that session. And the other one is, ask people to minimize interruptions. Your work will become so much more efficient, you know? So have your rules, like Raquel gave us rules at the beginning. Have a list of rules that you tell people before you meet with them what to expect. Turn off your cell phone, you know, if, unfortunately, a lot of the time they cannot leave the children out of the time, but if they can, accommodate for that, right? You know, find a place that is quiet, that there's not going to be, they don't need to attend to the door when they're doing it, or they don't need to answer the phone. So what are some of those interruptions that can be minimized so that you can use your time more effectively and you don't end up being frustrated? And finally, we talk about this. Teach people how to fish. Do not give them the fish. It will help them and it will help you. So hopefully everything that we talked about in session 1 and now in session 2 will help you make your work easier. These are additional skills. I think some of them might be repeated. You know, the other one, let me see how we're doing in time. We're out of time, so I'm not going to go through them, but you're going to get all of the slides. Dr. Kanzler, Katie put all of these excellent resources for you. She's recommending some apps here that have that work very well for the community. So please feel free to explore them. We don't have time to go through the questions, but like I said, we're going to be recording that video, answering or talking more about all of the comments that you have put us, so we will make it available to you. And one last thing, please, please, please answer the survey. The last survey that Michelle is going to send you is the shortest one of all. We need that to continue bringing you these opportunities. We are so lucky that you joined us today. It has been a pleasure. We're starting to build a network. We have all of your contact information. We hope, please stay in touch. If there's anything that we can do, let us know. And our takeaway messages is, self-care is not selfish. It is a need. So, you know, just like I said, right? You know, just like the cactus, how does the cactus take care of itself so that it can produce that beautiful fruit that the community needs to keep moving forward? Take care of yourself so that you can take care of others, and say no when you need to. Thank you very much. And anyone else want to say some closing thoughts before we unmute everybody?
I just want to say thank you, everybody, once again for being here with us on this Friday afternoon. It's truly been a blessing to have each and every one of you, and I've had some private chats. You will be hearing about more workshops, and keep a lookout for my emails, because I know a lot of you want the recordings as well. Thank you so much.
Thank you. Yes.
Thank you, everybody.
Thank you. Thank you.
Thank you. Bye-bye. Bye-bye.
Gracias, thank you. Muchas gracias.
Wonderful, wonderful.
Thank you, everyone.
Gracias.
Thank you.
Thank you.
Bye-bye.
Thanks a lot.
Bye bye. Adiós.
Cintia, muchas gracias por estar aquí. Thank you.